Good evening. Welcome to Left, Right and Centre. I'm Vishnu Som. The big story we continue to track, the process of vaccination now well underway in the country. But is it really keeping pace with the expectations? And are there any concerns at all on adverse reactions which could be taking place? At the moment, the government is very clear. The number of people vaccinated so far on day one of that vaccination drive against COVID-19, which began yesterday, is the highest of any country in the world. That said, it's not achieved what the ultimate goal was. But the sense is that the system will be more regulated over the next couple of days and that all of the targets will be met. We have a fantastic panel of guests today, including very shortly Professor Vijay Raghavan, Principal Scientific Advisor to the Government, also the co-chair of the COVID-19 Research and Development Task Force. He'll be joining me momentarily, but first, this report from Sukirti Dwivedi.
Only 64% of the vaccination target achieved on day one, but the government expects the numbers will improve next week and claims it was the highest day one vaccinations in the world.
Highest day one vaccination number in the world. मैं आपको बताना चाहता हूं कि ये संख्या किसी भी एक दिन में किसी भी देश में सर्वाधिक है, higher than USA, UK and France on day one.
Among major states, Maharashtra had a target of vaccinating 28,000 people on the first day, but about 18,000 people received the vaccine. Andhra Pradesh had a target of vaccinating over 33,000 healthcare workers, but vaccinated over 18,000 of them. In UP, around 21,000 healthcare workers were vaccinated against a target of 37,000.
Reaching 62% is a really good turnout according to me.
We took a decision that we will do only 30 as a first day at each of the 140 locations. If the doctors at senior level, if they take the vaccine and they give a statement or it is just to put to knowledge of people, I think that builds a lot of confidence.
Delhi had planned to vaccinate 8,117 people, but the actual vaccinations were 4,319, out of which there were 51 cases of minor adverse events or side effects and one severe adverse event. A 22-year-old security guard of AIIMS who had to be hospitalized but is stable now.
लास्ट मोमेंट के ऊपर वो टर्न अप नहीं हुए। जो वैक्सीनेशन है प्योरली वॉलंटरी है, कंपलसरी नहीं है, तो जो लगवाने वाला है उसकी पूरी छूट है कि वो लगवाए या ना लगवाए।
But what are adverse events? An adverse event following immunization or AEFI is any untoward medical occurrence which follows immunization and which does not necessarily have a causal relationship with the usage of the vaccine. The adverse event may be any unfavorable or unintended disease or symptom. These are categorized as minor, severe or serious. The Congress today targeted the government over the cost of the vaccine.
Will the members of scheduled castes, scheduled tribes, backward classes, below poverty line, above poverty line, poor and underprivileged get free corona vaccine or not? And the Belgium minister, on the other hand, said that the AstraZeneca vaccine is costing them euro 1.78 or 158 rupees. So question is, why is Modi government then paying rupees 200 for the AstraZeneca vaccine when they themselves are saying that they are supplying it at no profit?
Union Health Minister Dr. Harshvardhan had earlier said that the vaccines will be free for the first 1 crore healthcare workers and 2 crore frontline workers. The modalities of the cost of the vaccine for the general public are still being worked out. In New Delhi, this is Sukirti Dwivedi for NDTV.
Well, joining us now, Professor Vijay Raghavan, Principal Scientific Advisor to the Government. He's also co-chair of the COVID-19 R&D Task Force. Thanks, sir, very much for being with us. Firstly, have you got your jab as yet or not?
Not yet. I'm neither a frontline worker or a healthcare professional, so I will wait my turn.
And that, in fact, is the larger question. When would this go beyond the frontline workers to other people? Do you expect it now, given the pace, in a few months, or when?
The analysis for those in the first broad phase, those who are 50 and above, frontline workers and healthcare workers, that amounts to 30 crores people, is that this is done substantially in 7 or 8 months. So I don't think we should focus on what happens on day one and try to linearly extrapolate that. This is going to double very rapidly, the rate of vaccination, as the logistic supply chain gets better oiled from each day's experience. And you're going to see a rapid completion of this first part of healthcare workers and frontline workers, and then you're going to see the other part starting. So I would say this is on plan as of now.
So tell us a little bit about day one. Now, the overall numbers were perhaps the largest in the world, but it was what 64% of what the government targeted. So what were some of the concerns on day one? Why across many states were we unable to achieve that 100% target or close to it?
We must keep in mind the extraordinary diversity of the context where we are looking at vaccination. This is a very large country, and there are very many kinds of situations where the vaccination centers have to deal with. And the other end, you're going to see that people who have been allotted times need to come, even though they are healthcare workers and frontline workers, be available at the right time and be able to present themselves with all the proper documentation and so on. So I think a 68% hit on the first day is extraordinary, and we're going to see this cycling with repeat days, having those who have missed it coming in and new people coming in. So the coverage will be very good in due course.
And the total beneficiaries thus far have been 2,24,301. So that's overall a very large number. But you raised an interesting point. People aren't, or some people didn't turn up on time. So how would that work? If you aren't there on time, you don't get it on the same day. You don't queue up at the back of the line. You get it on another day. Is that how it'll work?
Yeah, all those will be. I mean, that's been part of the CoVIN app. You're given a time and a place, and supposing you can't do that, you have to then get back and say you couldn't come, and then you'll get another time. So these are the kinds of things which will happen, and this is the kind of matter which will be sorted out as we go along. It's not something which is inflexible. At the heart of it is going to keep people's convenience and their availability and their flexibility in mind.
Now, all major states will vaccinate on any 4 days of every week. Smaller states like Goa will vaccinate on only 2 days. UP is an exception. It will vaccinate only on 2 days per week. On what basis have you come to this decision? I'm just curious, trying to understand.
Well, this will of course keep changing as the vaccination program progresses. There are very close interactions every day with the Union Health Ministry and the Health Ministry in states, who in turn interact with their health officials in districts and taluks and so on and so forth. So this is arrived at from what is feasible in a manner where the correct thing is done. And this is a dynamic process. This is not etched in permanence by any means.
Where does India now stand with the distribution of the vaccines across the country?
The distribution has, multiple layers to it, right from the factory to large warehouses, to our smaller warehouses, and then further to the states, and then distributed, and then finally in the vaccine supply chain. This has been tested out several times over the last few weeks in dry runs. So distribution is not a critical issue. There will always be situations where demand in some places may be higher than supply, and in other places supply may be a little larger. But there are feedback mechanisms, again, to make sure that no vial goes waste.
What is your message to people watching this program who would want to know, who may be worried, including frontline workers, saying, is it right? What about adverse impact, reactions? Maybe I should just avoid it, right? So what is your message to them?
Yeah, there are 3 messages, but before I give those 3 components to the message, there's only one message. But before I come to that, let me point out that we must keep in mind what's happening in other countries right now, the UK, Brazil, the US, and so on. And this is very extremely worrying. And we are going down in our prevalence, and we must actually keep that. So what is the message? The message is that there are 3 components which affect the spread of this virus. One is what we do as people, as our society? Do we wear masks and keep distance? That can affect the spread enormously. The second is what the virus does. It changes regularly and it can become worse, it can become better. So scientists need to watch out for that and keep track to prevent that the virus from increasing spread. And that means the more we are careful, the less we are susceptible to the changes in the virus. And the third component is tools which affect the virus in an extreme way, such as vaccines. The faster we use vaccines and the more widely we use it, the virus's opportunity to change becomes less and less. So therefore, vaccination is very important. Take your dose when you get it, and widespread vaccination requires all of us to participate and support it fully.
So, we've seen these reports of very senior citizens in Norway apparently passing away as a result of after having been inoculated with the Pfizer drug. 23 fatalities apparently over there. So now we've not had anything of that sort, and hopefully we never will. But is this something that people need to be worried about? That if you are very old, for example, if you're very frail, if you've got very serious comorbidities, then these drugs might create problems.
In principle, there's no problem in taking a vaccine when you're old. And your healthcare context, your healthcare provider, the vaccination center will check and let you know. What happened in Norway is something which is still being analyzed, so we'll need to get more results. But it appears that there is a high degree of mortality in that cohort in any case because of their advanced age and frailty, and many of them were vaccinated. And now one needs to analyze amongst those who died in this short period, how many of them were due to the vaccine, that they were sadly pushed over, as it were, even though they were very frail and in advanced age. We don't know the results yet, but yes, it's important a lesson that we must take care when vaccinating the very old and frail.
Dr. Vijay Raghavan, in terms of adverse events, there is an expectation if you vaccinate at these numbers, statistical prevalence is there. Were we within that range of acceptability on day 1 and day 2?
There are two broad categories we can put adverse reactions of various kinds. One is those which are matters of concern, and then others which, after most of them have been eliminated, they still remain. This latter category of adverse events after immunization, which potentially need to be looked at, is very, very low. And it's too early to, comment on the numbers we're seeing now. But most of the numbers seem to fall into the category where people reported various kinds of reactions, and they were not of significant consequence.
All right. And between the two drugs, which Covaxin and Covishield, the adverse reactions were primarily from which, or was it equally spread?
I don't have the data for that. We will of course have that soon, but I don't know. There is no particular reason to think that one will have more adverse reaction than the others a priori. Okay.
The last time we spoke, I asked you about when data for Covaxin would come out. Is there any update on that, on the phase 3 trials taking place? Because you're monitoring this on a real-time basis. You don't necessarily have to wait for the full report. Ideally, you'd want it, but you have a real-time understanding as well. So how is that understanding advanced?
I will repeat and amplify on what I said last time, that the phase 3 trials for Covaxin are ongoing. When the total number of people who show symptoms of disease goes beyond a certain number, that will be unblinded, and then we will know how many of those are in the placebo arm and how many in the vaccine arm, and that will tell us something about the phase 3, which will still continue, as is continuing for the Oxford AstraZeneca vaccine in another kind of test.
Sure.
So I said last time, and I'll reiterate, that we should hope to get the results in a few weeks' time or a monthish. It was only a few days ago that you asked me.
Right.
So that hasn't changed dramatically. But there's nothing to change that view.
Sure. And a final question to you, Dr. Vijay Raghavan. What about some of the other drugs? For example, Dr. Reddy's with the Sputnik vaccine. where are they placed? Or some of the others? There's further Indian ones being developed. Where are these?
Yeah, there are many. Actually, there are many Indian candidates in addition to the Sputnik one you mentioned, which is a Russian collaboration, which are in the pipeline. There is a Zydus Cadila, which has gone into phase 3. There is Genova, which has a messenger RNA vaccine, which will go into phase 1 soon, hopefully. Then there are others which are earlier and which make 3 components of the viral protein, and those will come into phase 1. Yet another one is being advanced, which will make a vaccine which will be stable at room temperature. So these are very, very important for 2 reasons, because the more good vaccines we have, and the better and more robust our vaccination network is, but also this allows us flexibility as the virus mutates to actually tweak these vaccines and make sure that they go through rapidly through a process of approval, which can match any worrisome changes which may come about. So far, none of the changes are worrisome in terms of the vaccine being effective, but should those kinds of changes come about, they will be tested out, discovered, and substantiated in labs. But these many kinds of vaccines allow us to rapidly change and still not fall back.
All right, sir. Pleasure speaking to you once again. Thank you for answering all of these questions. So many people want to know about this entire process. Thanks so much indeed.
Thank you very much.
Well, joining us now, Rakesh Agarwal. He's with the Jawaharlal Institute of Postgraduate Medical Education and Research in Puducherry, and Dr. N.K. Arora, who is heading the Operations Research Group and a part of the national task force set up by the ICMR as far as all of this is concerned, the rollout. Dr. Arora, let me come to you first. It's a great day in a sense that, we are moving along at pace. The absolute numbers are very large. But before I talk about the vaccine rollout as it's taken place so far, let me just ask you a little bit more about what Dr. Vijay Raghavan was mentioning, that in the pipeline, other than Covaxin, Covishield, which we keep talking about, are other very promising drugs, which in, let us say, the next 4 to 5 months, we will know if they work or they don't work. And if they do work and it's accepted, then, there'll be more options, there'll be more supply, and there'll be a larger number of people. So is that something we should also be talking about, Dr. Arora, that the new drugs on the pipeline have a lot of potential?
Thank you, Vishnu, for inviting. There are plenty of candidate vaccines. And immediately we should have Sputnik, which phase 3 has started, I think, yesterday. Then we have Cadila Zydus, which is going into phase 3. These 2 are the most advanced. So in next 4 months or so, we should have these 2. We should know about them, 4 or 5 months. And as Professor Vijay Raghavan was telling us, there are at least 5 or 6 more candidates, and in the second half 2021, we should see them for wider use.
Okay.
And I'm sure you must have discussed it before with others. There are 6 platforms.
Mm-hmm.
And fortunately in India, all these platforms are being used to prepare various candidate vaccines. And in fact, India's Cadila Zydus is among the first one in the DNA menu.
Fascinating.
And we look forward that a lot of them are likely to be good, as good or maybe better. I think only time will tell us.
All right.
There is another dimension I think we should remember, that currently whatever vaccines are under use, whether it is Pfizer, Moderna, Covishield, these are the ones where we say effectiveness is known. But it is only short-term effectiveness. Only 2-month effectiveness is known for all these vaccines, or even for the Chinese vaccines. The long-term effect of all these vaccines which are currently used for emergency purposes, they are also being followed up. So over the time, how good each one of them, we will understand.
Mr. Agarwal, let me come to you next. This is an important point because a lot of people would be operating under the assumption that, look, I've taken my 2 doses, I've been diligent about social distancing, and now I am good to go for the rest of my life. In fact, that's not the case. There could be a booster dose a year later, a few months later. We don't really know, do we?
As of today, we have data only for a short period, as was also said by Dr. Arora a minute ago. But then that is fine. We take steps as information comes forward. As we learn about the duration, we will take decisions about whether a booster is needed or not as we go along. That has happened with all vaccines, except that in this case, we had information only for a few months. Previous vaccines, we had information for maybe 2 or 3 years, and then decision about boosters was taken. This is how science progresses. I think it's perfectly fine to right now take these 2 doses, and as we get more information about duration, and if there is a need for boosters, those can be given. If we can give 2 doses, we can also give boosters. That's not a problem. And there is a possibility that it turns out that we don't need boosters, in which case also it would be fine. Things will change. Things are rapidly changing. It's also possible that 2 years down the line, we have a vaccine where only 1 dose is needed. There could also be a situation where we will not need injections. We could have something that can be sprayed into a person's nose.
Yeah.
So all that will happen. We have to go with what we have today. And that's what we are doing.
You know, Dr. Arora, I was at the Serum Institute a couple of days back, and one of the points that came up was if the gap between the doses was expanded beyond the 28 days to approximately even 3 months, then the possibility of the efficacy going up from approximately 70% could rise significantly. But obviously that comes with its own risk, right? You're many months, a longer period where you're potentially susceptible. But is this not something that's interesting? If in this case of this particular drug, if you took the second dose 3 months later, you might have an 80% plus, 85% plus efficacy, which has obviously its bigger advantages. Your thoughts?
As a person who looks at vaccine
I would like to say.
Go ahead, Dr. Arora. Mr. Agarwal, I'll come to you next.
So the Covishield vaccine in India vis-a-vis Chadox vaccine in UK. Now, in their trial, there were too many things which are not comfortable. They had a proportion of patients who were given half dose. First dose was half dose.
Yes, and it went up to 90%.
And second was that in some of these individuals, they had to increase the interval between first and dose because the second dose stock out was there or availability was a limit. Now, if same thing is done in an Indian company, we will be characterized as poor quality people. So therefore, some of this information is very half-baked, I would say, and we should go exactly the way initial protocol was there, that a full dose with 28-day interval, and what is these are secondary analysis, and at this time, I think most of the people who are in this field are not very comfortable with the information which is filtering out this way.
Okay.
I will stop it.
Mr. Agarwal, final question to you. Certain countries like the United Kingdom, which are in a far worse position than we are presently, have suggested that you can mix and match drugs, vaccines, possibly because of availability, possibly because they're desperate. What are your views on this?
As far as I'm concerned, I'm a purist. I think exactly similar to what Dr. Arora said. We should go by the evidence that is definitely there. That evidence is for use of 2 doses of the same vaccine at a certain interval. Surely we can vary that by a few days, and we should stick by this. Anything else that comes from analysis of people within a trial who did not follow the schedule, who had a longer interval, or who took different vaccines, is what in science we call as hypothesis generating. It is not a true difference, and we don't have to.
All right. Well, I'd like to thank both of you very much for joining us and getting those views. It's there's so many questions to be asked, and thank you for providing us clear answers. Out of time on this program, we'll take this short break.